Welcome to the Political Checkmate, and today I'm going to checkmate the Rational National's video. Libertarian study shows Medicare for all saves $2 trillion. So here we go.
In just another example of conservative ideology failing when there's an actual honest discussion about the facts, conservative think tanker accidentally argues that single payer could save Americans $2 trillion. Now, this report is by Charles Blahous from the Libertarian Mercatus Center, and in it shows this. The report's methods are pretty straightforward. Blahous starts with current projections about how much the country will spend on healthcare between 2022 and 2031. From there, he adds the costs associated with higher utilization of medical services and then subtracts the savings from lower administrative costs, lower reimbursements for medical services, and lower drug prices. After this bit of arithmetic, Blahous finds that health expenditures would be lower for every year during the first decade of implementation. The net change across the whole 10-year period is a savings of $2.054 trillion. Now, this doesn't appear to be accidental. So, this report from a libertarian think tank, a conservative think tank, clearly shows that there is a savings of $2.045 trillion. So, why would they release this report? Well, this isn't how they framed it. So, this is from the this piece here is from the abstract on the first page of the report. So it states, the leading current bill to establish single-payer health insurance, the Medicare for All Act, would, under conservative estimates, increase federal budget commitments by approximately $32.6 trillion during its first 10 years of full implementation, assuming enactment in 2018. And that is all political theater.
The author of the study has debunked that claim that it would save $2 trillion, and you can read it in these articles. Anyway, if you actually read the study, the $32 trillion figure is a low estimate, with 40% cuts in reimbursements, while at the high end of the study, it is $38 trillion of costs with no provider cuts.
So they tell you that up front, which, yeah, obviously, if you are moving healthcare from a private insurance-based system now onto the federal system, yes, the federal government will be spending more money. But you have to think of how the cost is offset. So people will no longer be paying private insurance. They'll be paying through their taxes. So this is also broken down here. Since the federal government takes on nearly all health spending under Medicare for All, federal health expenditures will necessarily go up a lot, $32.6 trillion over the 10-year period, according to Blahous. But this is more of an accounting thing than anything else. Rather than paying premiums, deductibles, and copays for healthcare, people will instead pay a tax that is, on average, a bit less than they currently pay into the healthcare system, and for those on lower incomes, a lot less. But, of course, a report from a conservative think tank is not going to tell you that. They're simply going to show you the scary number. Oh, it's going to cost $32.6 trillion. Yeah, but if you're actually saving money, if the individual paying for their health care is saving money because now they are simply paying it through their taxes and paying on average less through their taxes and much, much less if you are lower income, then there is a savings there. There is a clear and obvious savings for the vast majority of Americans. But they don't talk about that. And because
No, Medicare for All would cost more for over 70% of working privately insured households, according to this Emory University study. This also assumes you're going to have a low estimate cost for Medicare for All. While a low-income household could be saving more money if we had a mutual aid society, people would pay a day's wage for a year's access to a doctor.
as they mentioned the $32.6 trillion cost up front, guess what the mainstream media picked up on? Bloomberg. Medicare for All bill estimated at $32.6 trillion over 10 years, study says. CBS News. Medicare for All plan touted by Bernie Sanders would cost $32.6 trillion, study finds. National Review. A new study has found that Medicare for All would cost a whopping $32.6 trillion over 10 years. Fox and Friends. The real cost of democratic socialism? New study finds giving Medicare for all would cost the country $32.6 trillion over 10 years. ABC News. Senator Bernie Sanders' Medicare for All plan would increase government health care spending by $32.6 trillion over 10 years, according to a study. Time. Medicare for all could cost $32.6 trillion, George Mason study says. Yahoo Finance. Medicare for all bill estimated at $32.6 trillion, says study. And New York Times study Medicare for all projected to cost $32.6 trillion. But I thought the media was liberal. Oh, the media is so liberal. The media is so liberal that they don't even bother to check if the actual, what the study actually says and how it actually saves money. But no, the liberal media is just, they are destroying the country. The liberal media has taken over, and they are telling you that Medicare for all is too expensive. Then how liberal is this fucking media? Clearly, it ain't very liberal.
Well, the articles I could find, such as CBS, National Review, and Time magazines, gave Bernie Sanders a response to the study, and I quote, "If every major country on earth can guarantee health care to all and achieve better health outcomes while spending substantially less per capita than we do, it is absurd for anyone to suggest that the United States can do the same," Sanders says in a statement. This grossly misleading and biased report is the Koch brothers' response to the growing support in our country for Medicare for All program. Also, the ABC article says it saves $2 trillion, but at least got scholar Robert Boyles, who debunks that claim. Anyway, the problem with Bernie's response is that according to a study from the National Bureau of Economic Research, it found that America's poor life expectancy is not the result of the U.S. healthcare system. On the issue that America is spending more than any other country, Chris Pope has responded to that claim. He pointed out that America pays more for doctors, and that we have more medical technology such as MRI machines. Other countries choose not to spend on certain treatments like the NHS on therapies that will cost over $40,000. And in fact, America spends less on out-of-pocket expenses. Finally, we have a more unhealthy population that is more obese, while the Medicare Center study is the author's own research. Other studies reached similar conclusions, like the Urban Institute and Emory University study and the Center for Health Research. Going back to David Dole's point of the liberal media, it is liberal. This study from the Quarterly Journal of Economics shows that the media is liberal, since a lot of journalists are liberals and more likely to cite things from left-wing think tanks.
Now, the savings that the analysis shows is actually conservative. It would likely save more money. So here's more. Messaging strategy aside, there is room to quibble with Blahouse's positive findings. He assumes administrative costs will only drop from 13% to 6% for those currently privately insured. But according to the Kaiser Family Foundation, Medicare's administrative costs have consistently been below 2%. He assumes utilization of healthcare services will increase by 11%. But aggregate health service utilization is ultimately dependent on the capacity to provide services, meaning utilization could hit a hard limit below the level he projects.
Conservative estimates means low estimates, not asking Republicans what they thought that estimate is. And again, multiple estimates came to similar conclusions. Medicare does not have lower administrative costs because you are not looking at all the costs, such as the IRS to collect taxes and Social Security Administration premiums, and also you're looking at different demographics. And in fact, the Mercatus study points this out. It is as if they did not read the study. Medicare for all will increase utilization because the services are free, and that will cause them to try and increase providers.
Now look, me as a Canadian, I already got this. I have healthcare. We have universal healthcare. And some of the stuff isn't even like, some of the great benefits of having universal healthcare isn't even mentioned in numbers because it can't be. Something like, I don't have to deal with private insurance at all. I don't have to weigh my options about who to go with. I don't have to deal with any private insurance companies. I never have to call anybody about private insurance. All I do is go to the doctor. Or if I need to, go to the hospital. And then I come home. That's what happens. But yeah, private insurance is the way to go, even though when these countries move to a universal system, they don't go back to a private insurance-based system. They keep their universal system because universal healthcare is incredibly popular once it's implemented. And the perfect example of that is the Conservative Party in Canada. You'd think a Conservative Party would be pushing for a private insurance-based healthcare system. They're not. So doesn't that show you something? There is no party in Canada pushing to take away universal healthcare because we all love it. Whatever side of the spectrum you're on, you want universal healthcare because you realize it is the only way to to have health.
You are going to weigh your options on who you're going to vote for in elections. And with private insurance, you can choose what healthcare plan is good for you and cancel the plan you don't like anytime. On the argument that many countries that implement free healthcare still have it, my response is that people falsely believe that private insurance, like in the USA, is a bad alternative. These people have a lot of criticisms of the free healthcare of the countries they live in, such as in Canada. There is a survey by the IPSOS. They found that less than half are satisfied with their healthcare, and 2/3 believe that private entrepreneurs can provide faster service. In fact, there's a lot of Canadian news and politicians criticizing their healthcare system.
Nearly 5 million people can't find a family doctor. And I'm the only leader with a plan to hire the doctors and nurses that Canadian families need.
Well, an overcrowded hospital has to use a donut shop as an emergency ward, and 5 million Canadians don't have a doctor.
The federal government told the cancer agency it would not be paying for his chemotherapy. Sister Carol Borison is speaking for him.
This gentleman's life was on the line, and the amount of anxiety and stress that had been added to his situation was awful.
Is to encourage people who are seeking ER care if they can use the health line, and then determine whether or not they can be dealt with at a walk-in clinic. Again, we have the health region estimating that 15 to 20% of ER cases can be dealt with at a walk-in clinic. He says, what is the government doing to ensure that we mitigate against this problem? 1,160 fewer healthcare workers under their regime, 450 fewer RNs from 01 to 06, 173 less doctors practicing during their last 5 years, 155 less pharmacists, and 95 fewer physios. Mr.
So this, I feel like most people at this point know this, and it shows in the polling. The majority of Americans support a Medicare for all system, and even more support at least a public option. So people are waking up and realizing that, yeah, I'm recognizing other countries around the world, whether it's in Canada or Europe, these countries have this universal system or have some type of universal system, and it works for them. And we, as Americans, consistently show that our healthcare system is not at the same levels as these other countries, and not only at the same quality levels, but also less people have healthcare. So, on average, 45,000 people a year die in the U.S. because of a lack of access to healthcare. A lack of access to healthcare that other countries don't experience. So that number in Canada is 0. 0 people die every year from a lack of access, because in Canada, you need healthcare, you get it. There is no lack of access. And that's not even mentioning medical bankruptcies, which is another, I believe it's the leading cause of bankruptcy in the US is medical bankruptcies. That too doesn't exist here because it can't. We have healthcare. So just, my God, can this debate be over now?
This article from Health Affairs debunks that 45,000 figure. It points out that the study only interviewed these people once and never checked to see if they have a lack of insurance. The same Health Affairs article cites a O'Neill study that looked at a 14-year period and found that the involuntary uninsured were only 3% more likely to die than people with health insurance, and that there was no statistical significant effect on the voluntary uninsured. In fact, the study with the 45,000 figure did not factor in things like Medicaid, while the O'Neill study factored that in and found a higher mortality rate than the uninsured. They also found that Canadians get less cancer screenings than Americans. People do die in Canada by their healthcare system by wait times. This study from the Fraser Institute finds that between 25,456 and 63,090, with a middle value of 44,273 Canadian women may have died from 1993 to 2009. On the medical bankruptcy argument, it is basically correlation does not equal causation. This study from PubMed debunks that argument and points out that 20% of Americans have medical debt, but given a year less than 1% of Americans file for personal bankruptcy. This shows that medical debt is rather a factor than a total cause. There is still medical bankruptcies in Canada, according to the study from the Canadian government, because of weeks lost of wages due to the illness, and also the Fraser Institute points out that personal bankruptcies as a whole from 2006 to 2007, there was more bankruptcy in Canada than the United States. This is the end of the video. Thank you for watching, and please donate to my Patreon so I can make more videos and have your video requests checkmated. And thanks for watching, and have a nice day.